So for those of you who don't know, plagiocephaly is distortion in the cranium. Where often one side of the occiput of the back of the skull will be flat, and the opposing side of the frontal bone will be extended, and the head looks like a parallelogram. One of the things that affects cranial growth patterns is the dural attachments, which is the dural system that we've talked about in many of our other classes, and the movement of cerebrospinal fluid, the pressure against the cranium. If the dural system is taut or too tight in one area, it will restrict the ability of the cranium to grow or the cranial bones to develop naturally. But in the first year of life, the brain is going to expand 101% of the time. So therefore, since the brain has to expand and the sutural system in the cranium is designed to allow it to expand and the bones being very soft, that the brain will then tend to push out of the area where there's less restriction, and that will create the distortion. So what chiropractic does is it finds the area of dural tension that is restricting the cranial bone growth, whether it be in the spine or in the cranium. It releases that dural tension, and then it allows the cranium to expand naturally and normally into the way it's supposed to develop. And again, if we catch it early enough, especially like I said in the first year of life, when the brain is growing 101% of the time, the cranium will actually remold and remodel once those tension membranes are released.